With more than 2.4 million illegal crossings last year, it's likely that illegal immigrants left a minimum of 14.4 million pounds of trash. Let me say that again. Illegal immigration is causing millions of pounds of trash to pile up on our federal lands. National Park Service employee at the Coronado reported that the trash piles there have grown so large that they have become resting spots for illegal immigrants who then need to be airlifted out of this ecologically sensitive area at enormous expense to the taxpayer. You cannot call yourself a true conservationist unless you are willing to take a hard look at the environmental toll illegal immigration is having on our public lands.
On average, every illegal that comes across that border is dropping between 6 and 8 pounds of trash. With 10 million illegals coming across that border, that's 80 million pounds of trash that is being dumped in our waterways, in our rivers. They're destroying our stream beds. They are destroying our farm ground. They're destroying our BLM lands. They are destroying sensitive sites.
First of all, you will see a pile of firewood. This is firewood that has been harvested in the Coronado National Forest. And here we have the firewood being burned. This is just happening in our national forest not far from here. Slide 3, you'll see the trash and food piles, all stacked up in the national forest.
I want to give a few metrics on something that I think is very important for what we're discussing today, and that's specifically the environmental impact of the illegal crossing. For a NEPA environmental review process, it takes approximately 6.1 years. To obtain a 404 permit under the Clean Water Act, it takes 10 or more years and costs hundreds of thousands of dollars. Over $1.7 billion is spent each year by the private and public sectors obtaining wetlands permits. The irony is that none of the individuals or companies undertaking a NEPA analysis or a 404 permit would ever be allowed to cause the type of environmental degradation and destruction that the cartels and illegals are causing throughout our southern border, as shown in the photographs that we saw today.
People seeking to enter our country without passing through a legal port of entry are breaking federal law. The damage these people do to the public and private lands while entering unlawfully is unacceptable, and the refuse they leave behind is remarkable. Where I live in Yuma County, my neighbors and I grow fresh produce such as lettuce, spinach, melons, broccoli, and cauliflower in season. The food that we're growing is mostly eaten raw by people all over the United States and Canada. We have individuals and families numbering in the thousands entering our country through areas that are not ports of entry on a daily basis. We face unique challenges having food crops of the kind that are normally eaten raw growing in open fields. We can't have trespassers entering those fields, passing through these fields, leaving garbage in these fields, or even worse, defecating or urinating in or near these fields. Is it too much to ask that farmers of southern Arizona, California, New Mexico, and Texas be able to raise their crops without being overrun by illegal immigrants and drug runners? I don't think it is.
Everything he's going through with the illegal migrants coming across his property, how on earth would somebody want to come along behind him and say, yeah, that's the career I want? And what does that mean for the American people when we have to have food? We have to have the things that are produced in rural America when rural America is being overrun with this crisis.
We had a unique situation where a whole group of Haitian immigrants camped out alongside one of our fresh produce fields, one of my neighbors, and stayed there for a couple of days. They were unique in that they weren't walking across the border and saying, here I am, where's my free bus ticket, my free meal ticket, my free airline ticket in my hotel room. They were less trusting of federal and local authorities, so they camped out for a couple of days, mostly women and children. You don't want people sitting next to your fresh produce field who you can't get to leave. The worst part about it is most of the folks that I mentioned in my testimony that legally work in agricultural fields in my community, the first and second generation immigrants, ask them what they think about what's going on today. They are appalled. These are people that spent tens of thousands of their own hard-earned dollars. Sometimes it impacted multiple generations. Many of them are the ones out here picking up the trash, refuse, and trying to make use of the crops behind this tragedy. The unusual thing is that in our community, we are short of workers every day to do work in our fields. And a good friend of mine recently approached Border Patrol about visiting some of the folks who are seeking asylum and who have entered our country without documentation that are being held temporarily. He approached them about asking them if they wanted to join the H-2A program. He addressed over 900 folks that had entered our country illegally, awaiting transportation or appointments with courts. And he received 0 takers on his opportunity to go to work.
They're not here for jobs. They're not here for opportunity.
At least not in the areas where they're crossing, for sure.
A public health crisis is also unfolding along the U.S.-Mexico border, as migration and public health are inextricably linked.
It was the economist Buckley that said you can either have an open border or you can have a welfare state, but you can't have both. And that's what we're seeing. You're seeing it in New York, you're seeing it in Chicago, you're seeing it in LA, you're seeing it in Denver. The hospital systems are collapsing. They're closing schools so that they can put illegal immigrants into the schools so that they can sleep there. When I was in the Yuma sector, last February, they had $28 million in uncompensated care that the federal government was unwilling to reimburse. And that uncompensated care was for illegal aliens. The women in Yuma cannot have their babies in their hospital. They have to go to feedings because there's no room in the inn.
When an individual comes into one of our emergency facilities in need, the humanitarian thing to do, the altruistic thing to do, indeed the legal thing to do under our EMTALA laws is to provide that care. And there's no question that a number of these individuals, indeed almost all of them, at some point in their lives are going to need access to our healthcare system. Now, whether it's for years and years of untreated chronic illnesses such as diabetes and asthma and heart disease, or whether it's for acute problems, our emergency rooms are going to have to deal with the complexities of these individuals. And in many instances, we're also dealing with the additional complexity of language challenges, cultural challenges, inability to obtain a full and complete medical history, which we've been able to do for most of our patients across the country. How that will be transitioned into long-term care, preventive care, is what really will have to be determined in the future.
You can have a welfare state where we can address our homegrown homeless population and mentally ill, or you can be bringing in millions of people who are going to need services. And we're now taking the services and the funds and the resources that we have away from American citizens and giving it to people who are here illegally. You have to look at this as an immediate crisis, a midterm crisis, and a long-term crisis. And unless we get a hold of it today, it's going to be worse 2 years down the road and worse 10 years down the road. That's why every single day that goes by exacerbates this problem beyond even almost being able to solve it because of the numbers that are coming through. What is ultimately going to happen with Social Security? What happens with Medicare? What happens with Medicaid? Eventually they collapse. And then the contract between the federal government and the citizens of this country is breached because there isn't going to be the resources to pay it.
What's happening is we've got all these people being encouraged to come here with a false promise of the American dream, and we're not being honest with them. And we need to be honest with them. We need to put policies into a place that make sure people obey our laws and that we have opportunities for the right people to come into this country under the right circumstances. And there's just so many things wrong with this. And another issue that you and I haven't even talked about is the fentanyl that's making its way up into Utah, killing our kids.
When I look at public safety, national security, and the humanitarian on our southern border, it has become the largest crime scene in this country. My deputies and law enforcement continue to be placed in life-threatening scenarios as the cartels show no regard for citizens and those that wear a badge. Arizona fentanyl seizures account for 51% of all the fentanyl seized in the country. In federal fiscal year 2022, Arizona seized over 60 million fentanyl pills.
The reason fentanyl, a synthetic opioid, has become so significant in that it is 100 times more potent than morphine.
By profession, I'm a pharmacist, and I will tell you that the fentanyl problem, the crisis that we have in the country, killing 200 people every day, the number one killers that Chairman told you of adults 18 to 45. I was embarrassed. I made a mistake. I was in a town hall meeting and I referred to it as fentanyl addiction. And a mother stood up and corrected me as she should have, and she said, "No, sir, it's not fentanyl addiction." She said, "My son took one pill and he's dead. It's fentanyl poisoning." It's poisoning our citizens.
This is about the sovereignty of our country. This is about American control of American soil. And when I hear a local sheriff and I hear a Border Patrol agent tell a committee of Congress that the Mexican cartels are the ones that are controlling not only the southern side of the border, but our side of the border, that puts a fire in my gut.
When I'm back in my district and I'm meeting with counties that are 15,000 people and they're losing a person a month to fentanyl, this is the #1 issue in this country, and we need to resolve it now. You know, especially when you have lawlessness, and that's what this is. And if they're going to cross the border any way they can, so they have no respect for our laws. They have no respect for our law enforcement. So at some point, you're going to lose your country. We've got to get our country back.
Well, certainly, if we ever give up on our border, then we give up on America, because clearly this part of the border is where really bad people come through. They're coming through the mountains that are in camouflage. They're seeing people coming with guns. You know, America needs to see what's happening here in Arizona. They need to hear about it, but more importantly, we need to work together to find solutions. There's nothing more important as a member of Congress, as a person that's in the federal government, to secure the future of this country for everybody that's currently living here and for all of our future generations. We don't politicize getting on an airplane, making sure everybody's safe and secure there, or on a port of entry for an ocean liner, but somehow the southern border, we politicize that.